Hi friends, this is your friendly neighborhood pediatrician Dr. Aditya Bhatt, and today we'll have a talk about rheumatic fever and rheumatic heart disease. As you know that it is due to cross reactivity of M antigen of streptococcal membrane, and you should know that there is no male and females are equally involved in acute rheumatic fever, while females are more affected in rheumatic heart disease. So that you must know. Now there are for rheumatic fever, acute rheumatic fever, there are five major criterias according to the modified Jones classification that you have to fulfill. So first is arthritis. Now arthritis is usually taken as polyarthritis when it is involving low risk population, while in high or moderate, even monoarthritis and polyarthralgia can be taken as a major criteria. Second, it is the most common clinical features of acute rheumatic fever, and it mostly involves large joints and there is excruciating pain, and they have absolutely dramatic response to NSAIDs. Now, another MCQ that might be asked in this is that the arthritis is inversely related to the severity of acute rheumatic fever and carditis. Next is carditis. Carditis is the most specific involvement of acute rheumatic fever. The most common valve involved is the mitral valve, and as you know that there is breadcrumb appearance and all the three layers are involved. Next feature is scoria, also called as Sydenham scoria and Saint Vitus dance, and this feature is also more common in female. There is emotional lability, motor abnormality, Wormian darting like a movement of tongue, Jack in the Box phenomenon, pronator sign, milkmaid grip, and jerky and staccato speech. Next feature is erythema. Now this erythema is evanescent, non-pruritic and painless, and it increases on heat and disappears on cold, and it is never ever seen on face, and it has irregular serpentinous borders. And the last feature are the subcutaneous nodules. Now another MCQ asked is that this subcutaneous nodule is directly proportional to the carditis and severity of carditis. These nodules occurs on the pressure site, and it is usually painless and firm, and it persists for less than 1 month. Now for the now there are also minor criteria. In minor criteria you have features like fever more than 38 or 38.5 degrees Celsius, ESR more than 60, CRP more than 3, increased PR interval. So now for the diagnosis of rheumatic heart disease according to the Jones criteria, you need, for the first episode you need 2 major criteria or 1 major and 2 minor, while in recurrence you require 2 major, 1 major plus 2 minor, or 3 minor criteria. Now, what are the exceptions to Jones criteria? So, exception to Jones criteria is that if the chorea is present as a sole manifestation, or eco-diagnosed indolent carditis which come to medical attention, or third, if it is a recurrent rheumatic fever. Now, there are titers. ESO titer is usually more useful in diagnosis of rheumatic disease, while the Todd's titer or DNase is mostly used in diagnosis of nephritic or PIGN or PSGN. Now, what is the treatment of rheumatic heart disease? The treatment of rheumatic heart disease is steroids. We give prednisolone, we give aspirin to prevent blockage or coronary artery abnormalities. For CCF, if the patient goes into CCF, we give digoxin and diuretics, and if the patient has severe manifestations of chorea, we give haloperidol and valproate. Now, for the secondary prevention, according to WHO criteria, there are three classes. So according to WHO and AHA, we have 2 different guidelines. I'll be posting this guidelines as photo, but I'll also briefly tell something about it. For the patients who have valvular disease, we have to give prophylaxis lifelong according to WHO. For those having no valvular disease but they have carditis, you have to give up to 10 to 25 years. And for those without carditis, you have to give up to 5 to 18 years of age. AHA criteria I'll post as a photograph. Usually we give benzathine penicillin 1.5 million units IM, and if the patient has anaphylaxis or allergy, then the second drug preferred is azithromycin. That's all for today. I hope you like the video. Please like, share and subscribe.